Hello and thank you for joining us. This is Health Matters on Channels Television. I am Mary Alale Yusuf. Worldwide, there are more than 246 million confirmed cases of COVID-19. By Friday, October the 29th, the death toll was over 4.9 million. In Nigeria, there were more than 211,000 confirmed cases of COVID-19, more than 203,000 recoveries, and 2,895 deaths. Globally, over 6.9 billion COVID-19 vaccines have been administered, while in Nigeria, over 5.6 million have got a first shot, and more than 53% of those are fully vaccinated. Now, brain drain is not a foreign concept in Nigeria. Many of us are aware of the squabbles over the years between doctors and the federal government. But did you know that a significant number of people also go on medical tourism, taking trips sometimes, several of them a year, for medical treatment? Nigeria loses between $1.2 to $2 billion, or about 576 billion naira, to medical tourism every year. That's our money just going abroad. Most of those going abroad for treatment suffer from non-communicable diseases such as cancer, orthopedic complaints, kidney and cardiovascular diseases. My guest is the Chief Executive Officer of Duchess International Hospital at Ikeja, Dr. Adetokunbo Shitabe. You are welcome to the show.
Hello, Mary.
So we're talking about how are we going to keep all that money back here in Nigeria.
Absolutely.
But first of all, let's even understand why they're taking all that money out.
Yes.
What are the problems people are facing?
Okay. Well, I call it a hemorrhage, and that's precisely what it is. About 600 billion naira every year.
That's staggering.
It is staggering. It translates to about 1.2 billion US dollars. And it simply boils down to a crisis of trust in the system. And it's a phenomenon that has been on an upward trajectory for I'd say the last 20 to 30 years. It coincides very nicely with the brain drain as well, if you observe the trend. Why is it happening? I feel we really do need to examine that issue, that simple perception, that concept of trust. If you think about what people want fundamentally from a healthcare system, Nigerians feel that they want and they deserve good governance, both clinically and administratively. They want world-class consultants. They want the level of clinical expertise that would help them feel reassured that their lives are safe in the hands of clinicians and the healthcare system. They want to be able to rely on tried and trusted technology and treatments. These are all of the things that people are going for, those who can afford it. These are all of the things that they're going for abroad at the end of the day. If we think about it, look at the range of treatments that people are accessing abroad. They tell us that about 60% of that is chronic disease, so diabetes, chronic kidney disease, heart disease. But there are also more minor things such as plastic surgery. For example, lumps and bumps. That is also
lumps and bumps. People go abroad to remove lumps and bumps.
Everyone. I mean, people do are particular about their health, and everyone has a right. There are many people who would tell you that health is a fundamental public good, but it boils down essentially to a question of trust.
It's a very interesting concept. You didn't just say lack of equipment or bad nurses.
Yes.
It's trust.
Yes.
And that takes some time to erode and even more time to get back.
Absolutely.
Let's talk about situating Duchess Hospital on the mainland. That was a pleasant surprise because people say that, everything good is on the island. What was that about? Why did you do that?
Again, it goes back, I feel, to the narrative that is at the very heart of our philosophy at the Duchess Hospital. We aim to reverse medical tourism by delivering the highest standards of care, ensuring that we provide the best technology and best treatments to give you the fastest, most convenient access to the best medical expertise available anywhere in the world. In order to do that, you have to give very careful consideration to how you position the service. It's a fundamental requirement. It is true, as you've not alluded to, you've clearly said, there is a perception that everything good is on the island. But if we think about it, and I'll have to say that this is a very carefully thought through service. If we think about it, quite a lot of the healthcare needs that end up in those really good hospitals on the island actually come from the mainland. So beginning with that first principle, reversing medical tourism begins there, redressing that fundamental disproportion just across the state of Lagos, across the bridge. It starts there.
So they don't have to go too far anymore.
Nobody has to go too far at all. And that is part of the hallmark of a good, robust healthcare system, that you have good, affordable healthcare at your doorstep. I mean, it has to be a fundamental requirement. And it's part of why, quite frankly, the truth is that it's often more difficult to nip across Echo Bridge than it is to get to the Murtala Mohammed International Airport.
No, you're absolutely correct. Yeah. Even to get to Ibadan, sometimes you can get there faster than to the island.
Absolutely. So therefore, we are on the mainland of Lagos, okay? We are catering to a need for the local communities. What it means, actually, is that we are within a few minutes. We're literally at the doorstep of the local airport and international airport. It means, actually, that we are within 90 minutes of any state capital in the country. So the reach goes beyond Lagos. And I might add, within 90 minutes, within 2 hours, of most major state capitals across West Africa as well.
I'm looking forward to that. When people will be coming from other countries to get healthcare, good healthcare in Nigeria.
Absolutely. So welcome to Lagos. It's a hub for medical tourism.
Now you say affordable.
Yes.
I've seen some of your equipment. That is a pretty pot of money that was spent in that place. I mean, I counted 6 dialysis hubs, 6 dialysis spots, 1 machine alone. Let's not even go there. Okay, so how are you going to be affordable? And what is affordable? Affordable is different things to different people. And still make, a living, make ends meet.
Okay, well, I will start precisely where you have asked your question. You've said that there's quite a lot of equipment there, and that is true. What that means really is quite a lot of investment. So that says something straight away about our commitment to delivering healthcare. Okay, that commitment needs to go first. Our philosophy is that we put service before payment, service before billing. But you are right. This must be underpinned by sustainable business in order for it to last. You're absolutely right about that. How do we intend to do that? I will start by answering that question by saying that we are here for the long run. Okay, we're not a flash in the pan, here today, gone tomorrow service. We're here for the long term. Okay, so we have made those investments, okay, with that in mind. The sheer scale of the service and the need, and we've assessed this. I mean, we've had calls from all over the world, people saying, we want you to do well, we are so happy. The demand is there. It's a 6.5 trillion naira industry. Quite frankly, it will take about 20 Duchess hospitals. So the issue really is not about competition or fear of breaking even. It's about delivering efficient service. Okay? So the scale is there. We're here for the long run. There are many, many efficiencies that will bring. We fully intend to pass that on to the patients. And I know you're going to get there, so let me anticipate your question. Okay? To register at the Duchess Hospital is 5,000 naira.
Wow.
That ought to blow your mind. To come and see a GP is 5,000 naira.
Wasn't expecting that?
No, you weren't expecting that. Access to affordable healthcare, we are absolutely committed to that. To see a specialist consultant is 10,000 naira. Now you tell me if you can beat that.
That's good. Now, before we came on, I was talking about oncology, and you corrected me. You said, no, not oncology, colonoscopy. So that got me thinking. people talk about how it's better to prevent things than to be treating things. So colonoscopy is just that, isn't it?
Yes,
Talk to us a bit about that.
So colonoscopy, what it entails really is having introducing an endoscope or a tube through the back passage in order to examine the full length of the colon. Begins in the area of the rectum. You'd like me to look that way? Oh yes,
it's on
the screen. That's right. So you can examine the full length of the colon, right through the rectum, the cecum, ascending, descending, sigmoid colon, in order to look for disease or the very early signs of disease. In our particular case, our colonoscopes are scope guide enabled, which means we don't have to fly blind. A colonoscopy requires a very high level of skill and technical expertise. The scope guide actually ensures that the dedicated colonoscope generates a number of magnetic waves that helps you configure the exact position of the scope. So you know where you are, so when you go to take a biopsy, you can take a very precise biopsy.
Okay, so no mistakes?
No mistakes at all. We have the equipment, quite enhanced, and we have the expertise.
100 patient beds. Yes. Where are you getting all those doctors and nurses that you need?
Okay, all right. Well, here is a very clever thing, and in order to reverse the trend of medical tourism and brain drain, recognize the fact that quite a lot has happened in the healthcare industry over the last 30 years. Okay, at one point, about 10 years ago, there was a Lancet article that actually said there were more practicing doctors in the United States of Nigerian origin than there were in Nigeria. In order to...
Wow!
Yeah, there are statistics around this that will absolutely blow your mind. In order to deal with this, we have to be innovative in our thinking. Okay. So we have 100 patient beds, and you've asked, where are we going to get the doctors? Well, the doctors are bound here and abroad. Nigerians are very clever people. So our strategy, our philosophy, I prefer to say actually, is to enable the brightest and the best here, support them with training, okay, in combination with experts in the diaspora of Nigerian origin.
So you're bringing them back?
We're bringing our boys and girls back. Okay, they want to come back. What we're doing is creating an enabling environment for them to come back to whatever degree they want to come back in practice. So there are those...
Okay, so we'll go back to that degree, but for now, we've got to take a break. We are going on a break right now, so stay with us. We'll be back after now. Welcome back. You're watching Health Matters on Channels Television, and we're talking about reversing the trend of medical tourism. Number to call is 0805-468-3514. It's going to be on your screen. If you want to talk about maybe ideas to reverse medical tourism or questions about it, while we'll continue the conversation. Dr. Shitabe, you were talking about bringing doctors back. Yes. To the degree that they want to come.
Absolutely.
Can you explain that?
Yes, I was talking precisely about bringing our boys and girls back. I feel very strongly about this. So we are creating an enabling environment, that will allow Nigerians who are, and Africans, and anyone else who's minded to come and join us in this, who are people who are doing amazing things abroad in the National Health Service, board-certified people in the US, doctors practicing in South Africa. It's amazing. Nigeria actually has exported an entire healthcare service out in the diaspora. So there are those who want to come back properly, permanently, like me. Okay. There are others who want to come and go. They want to spend 2 weeks. They want to spend 6 weeks. Do some procedures. But they've wanted to do this for a very long time. Nothing has changed. But they have never found a place in which they can do it safely. Okay. That is precisely what we are enabled to provide. A safe environment that allows them perform those complicated procedures, those things that give them pride and joy, okay, to the same level and degree that they're able to do it in the NHS and elsewhere. The Duchess International Hospital allows them to do that here in a perfectly safe environment, a learning environment, and it gives back and it rubs off. There are those who are here doing wonderful things locally as well. And there's that ecosystem, that cross-fertilization of teaching and training and knowledge, and the patient's benefit. That is the philosophy of the service.
Are you planning to have some collaborations with other hospitals? Because Nigeria is a very big place. The Duchess will be swamped.
Yes.
If you're thinking of doing it all alone.
Absolutely. Now, I said earlier, it's a 6.5 trillion naira industry. 600 billion hemorrhaging our shores each year. It will take...
Every single
year. That is, by the way, about 60,000 patients a year, each spending about $20,000 a pop. Okay? It will take about 15 to 20 Duchess hospitals. So we are not focused on the small-mindedness of competition. We're all about collaboration with the doctors individually, with the other practices, and we're hoping that more and more Duchesses will spring up over the next few years.
I saw some of those interiors, and I had a hard time convincing myself it wasn't a hotel. Is there some philosophy to that?
Yes, there is. There is, and you can tie it back to the name Duchess. It's a royal standard in healthcare. We believe that our patients deserve the best. The Nigerian patient, individual, deserves the best. Okay, so again, another dimension to our philosophy is that we combine excellence in healthcare with a unique experience of hospitality. And everyone who walks in through our doors has the absolute right to enjoy that. And that is what informs the environment that you see.
Okay, so what is the range of medical services? Should we be thinking of primary, secondary, tertiary healthcare, or you're just focused in one place?
Right, we are a one-stop shop. Primary healthcare. I'm a family physician, for example. Secondary healthcare. Tertiary healthcare, we will be, and I'm absolutely certain of it, a super specialty referral center. And we want to build those sorts of bridges right across the country and across sub-Saharan Africa that will allow us do that precisely. So it's a one-stop shop for everything.
I really want to talk about the Children's Center.
Yes.
It is so colorful.
Yes.
What all are you going to be doing for children there? But first of all, let me ask, do you think children are missing out in healthcare services right now in Nigeria?
Well, what I will say is that the very extremes of care, children and the elderly, and every healthcare system needs to pay particular attention to those because they have peculiar needs. It is so important. I'm not sure that I would want to go as far as saying that children are missing out. Of course, the service could be improved by so much, but I want to recognize, what I would rather do is recognize all the amazing people that I know in pediatrics who are doing such amazing work. And again, say that the Duchess and hospitals like the Duchess will provide the sort of environment that allows them practice the way they want to practice. Again, going to the other extreme, the elderly, they have peculiar problems. We know, of course, that that end of the extreme of the spectrum in Nigeria has been somewhat decimated.
That's true.
The average life expectancy is just over 50. The median age in this country is about 18. Okay, but when you consider the fact that only about 50% of people worldwide have access to an MRI, okay, and we can provide that at the Duchess, and we have the facilities and the expertise to cater to chronic disease, which increasingly becomes a problem of the elderly.
Yes.
What that says to you is that we are absolutely focusing on both ends of the spectrum and everything in between.
So we'll be expecting to see longer life expectancies.
Absolutely.
People who, yes, they may have a disease, but they're able to live with it rather than die from it.
Absolutely, and to put it in context, one of the problems that the UK National Health Service has is that people are living too long. It's a good problem to have.
It is a good problem.
So average life expectancy in those places, maybe about 70, thereabouts. We need to do something about this. And it is absolutely tied to the quality of healthcare systems and infrastructure that we have. So we need more Duchess International Hospitals. We're focused on collaboration, not competition.
Okay, that's good to know. Now, I know a number of doctors, I've spoken to them. It would be a dream come true to get their hands on some of the instruments, I saw.
Yes.
And so do you have any structured plan for training, or just, let these people come and put their hands on some of these things and do some procedures?
Absolutely. You're pushing on an open door there. I've spent the majority of my career focused on training. We describe ourselves as a learning organization. It is absolutely fundamental to who we are. So everything is built around teaching and training. We have an auditorium, for example, that sits 150 people, the connections from the theatre, audiovisual connections. We want to, all of our policies and procedures are built around rolling out teaching and training. We want collaborations, for example, with the West African colleges. There's LASUF down the road. We are looking forward to that. So yes, we will be absolutely true to what we profess. We are indeed a learning organization. I'm really looking forward to that. By the way, we have a directorate that is dedicated to that, a Directorate of Clinical Governance and Education. So it tells you precisely how seriously we take the subject of teaching and training.
So does somebody just walk up to Duchess, I want to be seen here, or do you have like a system of referrals that... Who sent you here? No, sorry. You've got to bring a referral. Yeah. How does it work?
Okay. I mean, if we lean back on what we discussed earlier, we're a one-stop shop. So primary care, which is the service you just walk into. Secondary, okay, you begin to talk about referrals, and tertiary is more super specialty. Yes, patients can walk in, and remember I spoke earlier about the fact that you can register at the Duchess for 5,000.
That's right.
You can see a GP, a family physician, for 5,000. Our GP services are bifurcated. There is the daytime service, which is by appointment. Okay, but then we also have a walk-in center, a GP urgent care center, and that runs overnight. And you can walk into both those services. Yes.
Okay, we'll have to stop there. I was going to talk about emergency, but we've run out of time.
Time flies.
Thank you so much for coming to the show.
It's been a real pleasure.
It's been wonderful having you. And it's been wonderful having you at home too. Have a wonderful day. I am Mary Alale Yusuf.